Diabetes is a chronic condition that affects millions of people globally, but not everyone understands its intricacies. Today, we'll dive deep into the world of diabetes, breaking down the different types, their causes, symptoms, and treatments. Diabetes occurs when your body can't regulate blood sugar, or glucose, effectively. Glucose is essential for energy, and insulin, a hormone produced by the pancreas, helps transport glucose into cells. When this system is disrupted, glucose builds up in the bloodstream, leading to serious health complications. There are several types of diabetes, each with its own set of causes and treatment methods. The most common types are type 1, type 2, and gestational diabetes. Let's begin with type 1 diabetes. This is an autoimmune condition where the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. As a result, people with type 1 diabetes cannot produce insulin and need to take insulin injections for life. This form of diabetes is often diagnosed in children or young adults, but it can develop at any age. Without insulin, glucose can't enter the cells, causing blood sugar to spike. Symptoms include extreme thirst, frequent urination, weight loss, and fatigue. Managing type 1 diabetes requires constant monitoring of blood sugar levels and administering insulin via injections or an insulin pump. Next is type 2 diabetes, the most common form, accounting for about 90–95% of all diabetes cases. In type 2, the body becomes resistant to insulin or doesn't produce enough insulin. This condition is closely linked to lifestyle factors such as poor diet, lack of physical activity, and obesity. However, genetics also play a role. Unlike type 1, type 2 diabetes often develops in adults, though it is increasingly common in younger people due to rising obesity rates. Type 2 diabetes can sometimes be managed, and even reversed, through lifestyle changes like adopting a healthier diet, increasing physical activity, and losing weight. For some, medications or insulin may still be required to keep blood sugar levels under control. Gestational diabetes is another type that develops during pregnancy. It happens when the body becomes less sensitive to insulin due to pregnancy-related hormonal changes. While gestational diabetes usually disappears after childbirth, it increases the mother's risk of developing type 2 diabetes later in life. It can also pose risks to the baby, such as high birth weight or preterm birth, and increase the child's risk of developing diabetes later on. Beyond these three main types, there are other, less common forms of diabetes. Maturity-onset diabetes of the young, MODY, is a genetic form that affects young people and doesn't always require insulin. Latent autoimmune diabetes in adults, LADA, is another form similar to type 1, but it develops more slowly, often misdiagnosed as type 2 diabetes. Some medications, such as steroids, can also induce diabetes, known as drug-induced diabetes. Despite the differences between these types, the symptoms of diabetes are often similar: frequent urination, extreme thirst, blurred vision, fatigue, and unexplained weight loss. If you experience any of these symptoms, it's crucial to get tested early. Early diagnosis and treatment are essential for managing the condition and preventing complications. Speaking of complications, diabetes, if uncontrolled, can lead to a host of serious health issues. These include heart disease, kidney failure, nerve damage, and vision loss. Proper blood sugar management is key to preventing these complications, and for most people, this involves a combination of lifestyle changes and medication. Regular exercise, a balanced diet, and careful monitoring of blood sugar levels can significantly reduce the risk of complications. A diet rich in whole grains, lean proteins, healthy fats, and vegetables can help stabilize blood sugar levels. Exercise also plays a critical role, as it improves insulin sensitivity and helps manage weight. The good news is that technological advancements have made managing diabetes easier. Continuous glucose monitors, CGMs, and insulin pumps have revolutionized how people with diabetes control their blood sugar. And there's exciting research on the horizon. Innovations like islet cell transplants and gene therapy are being explored, offering hope for new treatments or even a cure. In conclusion, whether it's type 1, type 2, or gestational diabetes, managing this condition starts with awareness and action. If you or someone you know is at risk, don't wait. Talk to a healthcare provider, get tested, and take the steps necessary to improve your health. Remember, small changes today can make a big difference tomorrow. Thanks for watching, and be sure to subscribe for more health insights. Stay informed, stay healthy, and we'll see you in the next video.